Kibera, tin-roofed, mud cake structures, bumpy and narrow dirty roads. At every street corner, women and men alike strive to make ends meet. As of 2019 Kenya Population Census, it is estimated that this peri-urban settlement in Nairobi, Kenya had over 182,000 residents. Struggling to have a decent life and basic needs is an ongoing reality that is evident in each household. Could this be a representation of both the challenge and promise of a rapidly developing area? Look closer at Kibera. Here is what you'll also see: a giving community, a community that is resourceful, with a strong identity, a sense of responsibility and care for others, with a tenacity to embrace life. What started as a 3-person initiative has evolved to become one of the top organizations changing the narrative in Kibera. Carolina for Kibera carries a story of hope, change and promise over the 20 years of its existence in Kenya.
The development of Carolina for Kibera was not easy because, one, we were coming into a community that was extremely volatile. Second, if you look at the history about Kibera and the development of the community, you realize at that time, nearly 70% of any NGO, CBO, multinational agency, they were all working in Kibera.
Our theory of change is that investing deeply in local leaders, young people who are local leaders, can change the community. And you see that doesn't happen overnight, but they become role models, and they have some of the solutions to the problems that their community itself faces.
Growing up, I saw my mom work so hard to ensure quality and affordable healthcare in Kibera. At that particular time, most of the services she provided for her community was free, not even almost free. The journey and the vision of Tabitha shows hard work, patience, resilience, and trust in the community that you live in. Yeah.
Over the last 20 years, CFK has empowered residents of Kibera to provide world-class medical care, educational and job training programs, and mentorship and advocacy for young girls in the community. Under primary health care, CFK operates 4 healthcare facilities: Tabitha Medical Clinic, Tabitha Maternity Home, Lishe Bora Nutrition Center, Young Health and Wellness Center. Through a participatory development of the Community Outreach Project, CFK works directly with residents of Kibera to bring new opportunities to improve lives and alleviate poverty.
We normally go to the community to identify severe and moderate cases of malnutrition, giving health talks in the community pertaining any health pandemic that is in the community. I think we have done great as CFK to support the children, because you know that young child, she cannot speak for herself or himself.
Nasikia vizuri juu wamemsaidia sana. Kama si hao sijui vile ingekuwa. Nasikia wamenisaidia sana tena sana kabisa, na washukuru kabisa.
Hiyo siku nilikuwa nasikia labor, nilitembea nikakuja. So ni mali unaweza manage kutembea, unaweza chukua hata pikipiki kuja haraka. Kwa upande wa watoto imepunguza hiyo hiyo tabia ya mama kuwa ati mtoto ni mgonjwa na rush anaenda kununua dawa kwa chemistry, na unanunua dawa huwezi jua ni nini inafanya mtoto. So instead of buying dawa kwa chemistry, peleka mtoto hospitali atibiwe.
CHV ninafaa nitembee na mama 1000 days, kumaanisha ni wakati ako mjamzito mpaka akuje ajifungue mpaka mtoto afikishe miaka 2. Maisha yao yamebadilika kwa sababu watoto wanapata chanjo yote, kliniki wa mama wanaenda. Hapo nyuma watoto wa mama walikuwa wanazalia kwa nyumba kwa wakunga, lakini saa hii kila mama anajua kujifungua ni hospitali.
Singepatana na watu wa CFK, singejua jinsi mtoto amelala kwa tumbo, hata singejua jinsi hii uvimbe ilikuwa kwa tumbo iko namna gani. Juu wakati wangu wa kuzaa ilikuwa imefika, hawangeangalia wajue iko namna gani, singejifungua vizuri.
To develop and create impact for youth in this community, CFK also has an education and livelihoods program that focuses on sponsoring their academic and economic development.
Education and livelihoods program is intended on providing both education and economic opportunities for young people. And so how we've designed the programs is that they are integrated in a way. So you do not just consume one service, but in a way you'll somehow consume the other also.
It's been an experience cutting through different levels. First as a student, beneficiary, graduated to a volunteer and an intern. Eventually, I am an employed staff.
Under the same program, the youth also have a Sports for Development project, which nurtures teamwork, leadership, and equality.
The power of sports was then brought to the fore, or to really see on how the young people could be absorbed, or just to see on how the ethnic tensions that were there then could be quenched. And there was no better way of doing it, apart from bringing the youth together within the sporting arena.
My entry point to CFK was soccer. Through CFK, I was serving my community. I was already a change agent in my community. I am among the 60 young people who were awarded by Her Majesty the Queen at Buckingham Palace in 2016. The Queen Young Leaders Program identifies, celebrates and supports exceptional young people across Commonwealth countries who are taking lead to transform lives in their community.
My life without soccer, I think it will not be good. Most of the time that I have, I think about football.
Playing soccer turns out to be one of my best thing I've ever liked in my life. When you're playing football, this confidence that comes from deep inside you that makes you want to play it all your entire life.
By recognizing the unique challenges faced by girls in this community, CFK runs a comprehensive program, Binti Pamoja, meaning Daughters Connected, to address their needs through mentorship and advocacy.
I joined Carolina for Kibera in 2004-2005, and I was still a teenager. So now I'm currently a full-time staff with the Girls Empowerment Program. I must say that it has impacted a lot of girls in the community, and it makes me a happy woman now to see a lot of girls making informed decisions, having the right direction in lives, through our safe spaces module.
As a girl from Kibera, there are always stories from Kibera girls getting pregnant, not clearing high school, but then seeing girls from Kibera, still the challenges were there, but having an environment whereby we will be able to express ourselves and talk about these challenges, really raise our self-esteem and also to face each day at a time.
CFK is a catalyst for positive change and is responsible in informing and assisting participatory development in peri-urban settlements like Kibera.
The growth of CFK has been a very natural growth. in terms of starting somewhere and very quickly beginning to learn from the experiences of very small engagements and using those lessons and experiences to grow over years. And so over the last 20 years, we have gone through that, learned our lessons, made our mistakes, and gathered sufficient information that makes us feel that a good portion of our programs have been indeed successful in terms of creating impact and influencing policy at national and global level.
It's amazing to me to see that 20 years on, those kids that were tiny when I joined in 2009 are now grown-ups. They have families, they have jobs, they have children, and they're still connected to CFK. And I find that really inspiring and really powerful.
We will be taking what we've learned over the past 20 years at participatory development and how we work at communities and take that model to other informal settlements to really create and bring knowledge about interventions that can help a community thrive and grow.
It was quite clear that the work of CFK was changing lives. And so it wasn't a hard sell to want to be part of that. And we thought that we were adding our own component that was, cumulative. It was making the impact of CFK even greater. And so it was a pleasure to be part of that.
I think CFK gives you the opportunity to see the changes that you're making firsthand. So if you're underperforming, you will see it in community because you're based in it.
We need more organizations like CFK to be able to amplify these voices of the communities.
When I look back, I would say that CFK has grown in terms of structure, and the way we were organized at that particular time is not what we are at this particular time.
We've seen a change in approach in terms of how NGOs are doing work in Kibera. That's extremely important for CFK as a major milestone. And this we've seen in terms of where we've managed to assist many of these organizations to rethink in terms of their approach.
20 years, it's important to reflect and step back and sort of celebrate, but also to not get complacent and to be focused on the future, which I think is also very bright.
With these comprehensive approaches focusing on accurately assessing the needs of the community and developing relevant and impactful programs, CFK will expand its services beyond Kibera.
One of the strategies we are considering through partnership is working with like-minded organizations that exist in the counties that we have started to work in. These counties being Kisumu, Nakuru, Kiambu, Kajiado, Machakos, Kilifi, and Mombasa. I think of CFK as a butterfly, where it has gone through the stages of growth that are inevitable in nature. So where you move from a pupa to a larva, and now I feel like we're at the stage where we're flourishing into the butterfly that we were meant to be.